You can begin. Thank you. Welcome, colleagues. My name is Brian Morales, and this is the Global Coalition to Address Synthetic Drug Threats. This is the May meeting, Working Group 1.1 West. I'm going to share my screen and have a few things to start off with. First, I want to share that this month we will be having presentations from civil society in the other sessions, the ones that you'll see tomorrow on public health. But we will have presentations from civil society, but not participants. So the participants will still be from representatives from governments. We want to take this opportunity to thank the Vienna NGO Committee for their past work on hosting meetings over the past months and for helping provide feedback to us from civil society sector. And per our usual practice, for tomorrow's civil society sessions, we will be recording the presentations, but we will not be recording the discussions. Now, we enter an interesting phase in the coalition's work at this time. We are now in the implementation phase, and we are asking all of you colleagues to please provide reports on actions that have been taken to address synthetic drug threats. So we have conducted some outreach already through US embassies in your countries, directly to your foreign ministries, to request that these actions be shared with the coalition. And we're also sharing today with you what that report would look like. We're also finalizing an official letter that we will be sending out in the next few days, requesting a report of your actions. And these actions will be shared on our website, and some content may be shared in the year one report. So what actions could you report? First, we would like to know any adoption of a new practice, a policy, a strategy, a regulation, or a law that has been done at a national level. And I'll just share that this would be from the time period of July of last year when the coalition was launched, July 7th, all the way through September 1st, right before the UN General Assembly, where this report will be released. Second, any engagement that has been launched or collaboration with the private sector over the past year. Third, any financial support that has been provided bilaterally through international organization partners or any in-kind assistance that has been provided to build the capacity of a country or to advance an initiative that addresses synthetic drug threats. Fourth, any a meeting that has taken place on a regional or global level, or one that is planned for the coming few months of the coalition that covers a thematic area of interest. Fifth are the initiatives, the famous initiatives, the 120 plus that are on the website developed by international organizations. So if your country, if you have joined one or more of these, those can also be considered achievements of the coalition. Six, any other act to strengthen your country's response to synthetic drugs, consistent with the recommendations. The reports should be no longer than 2 pages in length, and we will accept either Word or email format. They can be in English, preferably, or in another language. And we're asking that you submit these by the 3rd of June, within 2 weeks. The emails should be submitted to Synthetics Coalition. Sorry, the reports should be submitted to Synthetics Coalition at state.gov. And now I'll also share with you that the recommendations have been posted, the final recommendations of the coalition. They are on our website in the timeline section in an orange bar. So feel free to take a look at those. And I finally want to end with this last opportunity to present. The coalition monthly meetings are coming to an end in September. That will be a working group meeting. Our final sub-working group meeting is in August. So if you are interested to present in an upcoming session of the coalition, please contact us as soon as possible at syntheticscoalition@state.gov. And with that, I invite you to send us any questions either in the chat or by email that you may have on the report that we are requesting from your country. But for now, I will stop sharing my screen and I will turn it over to our co-chairs for today, Mr. Andrew Cunningham, Mr. Henning Root. Over to you, Andrew.
Thank you very much, Brian. I hope everyone can hear me well. I believe I'm on my own today yet again. Henning is not yet back in action, so I'll carry the meeting on my own today. So welcome to everybody to the May session of Subworking Group 1.1 on manufacturing of synthetic drugs and their precursors. And clearly, if you had tuned in last time, we're here to talk about engagement with the industry. This was the topic, the theme that came out of the recommendations that we decided to tackle in this particular meeting. As Brian said, the invitation to present at the next meetings are open. And in June, we will be covering operations, in July, capacity building, and in August, legislative response. So if anyone would wish to present during any of those sessions, I would really encourage you to get in touch. So as I said, today we are going to talk about engagement with industry, in particular, public-private partnerships, which of course are very important when we talk about the manufacture of synthetic drugs, because of course, without the chemicals needed and the equipment needed, it's not possible to synthesize synthetic drugs. So engagement with the industry is really a key element, particularly relevant for our subworking group. So today we've got 3 speakers lined up for you. First, we have a speaker who's coming from the industry themselves, in particular the shipping industry, who will talk about public-private engagements and partnerships. Then we have a speaker from the US DEA Office of Diversion Control, who's going to talk about regulations. And then we're going to listen to a colleague who will talk about using the private sector for public training. So these are the 3 speakers we've got lined up. So I would suggest that we proceed with the first speaker. And could you please think of any questions that you have for the speakers, and we'll save the discussion for the end after the 3 speakers have managed to give their presentations, if that's okay. So without further ado, I'd like to switch over and invite Mark Tierney, Head of Regulatory Affairs for North America. He's coming from the industry. He's working for Maersk, and he's going to present to us an interesting talk about public-private engagements with the maritime shipping industry. Mark, I know you had issues with your audio earlier. I'm hoping it's all resolved now.
And Mark, I see that you're unmuted, but we are not able to hear you. Can you talk to us, Mark, for the audio test? And Mark, unfortunately, I'm still not able to hear you. Testing, Mark. I see that you're not speaking and your video froze. And Mark, can you talk to me a little bit longer, please? Okay, Mark, I cannot hear you. And it may be an issue with your headset or your microphone. Can you please unplug your headset and try to talk to us again? Unplug your headset, please, and try to talk to us again. And Mark, I'm still not able to hear you.
Mark, I would suggest maybe that we let you disconnect and reconnect, and then we'll move on to the second speaker on the agenda, and you can work on your connection if that's okay. Okay, so let's move on then. Our second on the bill was, is Paul Ripacci. He's program analyst working at the import-export section of the US DEA Office of Diversion Control. And Paul is going to talk to us about the Import-Export Regulations 101. So hoping to learn a little bit from this session. Paul, you have the floor.
And Paul, right
Good
now,
morning, everyone. This
yeah,
is
I'm
Paul
sorry, go ahead.
Rapacci. Can you hear me?
We can hear you. Go ahead, please.
Wonderful. I'm a program analyst. I work in Diversion Control Division in DEA Office of Regulatory and Import-Export section. And today I'm going to talk about the program for monitoring our regulated machines. Can you see my slides? Okay.
We can see your slides, but you may want to start a slideshow and move them into the
Yes.
presentation mode, please, whenever you're ready.
Okay, let's see if that works. Is that work?
And we can see a blank screen right now, blank black screen.
Okay,
And
let
can you
me,
please? And now I can see your slides.
oh, now you can see it. Oh, let me do
Yes.
that again. So slide presentation, it's a momentarily. Can you see it now? Okay.
And I think it is still showing up on the screen. We can still see that in the presentation mode, so you may want to click slideshow and then from beginning, and we will see how it works.
Okay, I have it selected slideshow. And can you see my first slide, disclaimer slide?
We still see them in the presentation mode in the thumbnails on the left and the biggest slide on the right.
Oh,
If that doesn't work, that doesn't work. We will have to stay in this mode. But just to be on the safe side, if you can again click slideshow and then from beginning, and we will see what happens.
okay, okay, slideshow.
And then from beginning, it should be on the left.
I'm having a hard time hearing. One
Uh,
second.
te- Testing 1 2 3. Can you hear me better?
Is that better?
I still see your slides on the big screen. I think we can go ahead. No, no, it disappeared. So let's go ahead and stay in this mode. You can just,
Okay,
yeah,
I apologize
yeah,
about that.
yes, and your slides are cutting in and out. If there are any technical issues, I will let you know. But otherwise, you can just go ahead and advance your slides by clicking the thumbnails on the left. And please go ahead.
Okay, again, my name is Paul Rapace. I'm a program analyst at DEA, and I'm going to speak today on the program for monitoring regulated machines. We have just a disclaimer slide that this is for educational purposes and guidance from DEA. So today's objectives are to explain our program for monitoring the importation, exportation, and domestic transfer and distribution of regulated machines. I'll explain how a regulated person reports to DEA on regulated machine transactions and discuss some of our challenges that we face. So the mission of our our import-export section is to administer and monitor DEA's program for importation, exportation of controlled substances, chemicals, and also regulated machines. We issue declarations, permits, and monitor transshipments and regulate machine transactions and issue status notification letters, which are clarification letters on controlled status. And we also implement programs in accordance with congressional legislation and international treaties. We follow under the United Nations Convention. The United States is party of all three treaties of the convention. And under the convention, DEA has implemented the Controlled Substance Act. So the Controlled Substance Act is a series of statutory requirements for substances of abuse, creating a closed system of distribution. We established the statutory requirements to register and monitor importers and exporters of controlled substances and listed chemicals. And we created the statutory guidelines for chemicals that are used in illicit manufacturing of drugs and a legitimate manufacturer of controlled substances and listed chemicals. And we, of course, execute under international obligations of the United Nations treaties. Under the CSA, we have three sections of the Code of Federal Regulations, which we follow. 1312 regulates the importation, exportation, and transshipment of controlled substances. Section 1313 regulates the importation and exportation transshipments of listed chemicals. And for today's discussion, we'll be specifically speaking on Section 1310, which regulates the machine transactions and importation, exportation of tabulating and regulated machine encapsulating machines. So today we'll talk about definitions. We'll go through what are the regulated machines, the laws and regulations and reporting requirements. We'll talk about the reports of regulated machines, a 452, is DA Form 452. We'll talk about the regulated person's record keeping requirements, proof of identification, and in perhaps a chance that their machine gets detained or seized at the border, we'll talk about interactions with that and provide our contact information. So the regulated person means any person who manufactures, distributes, imports, or exports a listed chemical, tabulating machine, or encapsulating machine, or acts as a broker or trader for an international transaction involving either a listed chemical or a tabulating encapsulating machine. And just a regulated transaction means that distribution or importation or exportation of the regulated machine itself under the CSA. So regulated persons are not necessarily registrants, and we'll get into that later. So defining what a tabulating machine, it could be a manual, semi-automatic, or fully automatic machine that is used to mold powder or granulated solids into semi-material or to produce a coherent tablet. So these could be one at a time kind of machine, or one desktop mounted which produces several thousand tablets to many hundreds of thousands of tablets for pharmaceutical use. Similarly, an encapsulating machine can be a manual, semi-automatic, or fully automatic piece of equipment that fills shells or capsules with powder, semi-solid material or liquid to form a legitimate capsule controlled substance, for example. All these definitions are defined under 13.02. So the laws and regulations and reporting requirements under 13.10.05, a regulated person must file a report of a transaction to DEA through our DEA secure network application system. And for domestic distribution or transfer, they must file within 15 days after the shipment of the machine to the purchaser. For importation or exportation, the importer or exporter must inform DEA within 15 days before the shipment of the machine to the purchaser. So we have time to investigate, and Customs has time to review and verification of reporting requirements by DEA. We have an online system and called IMAX, Import-Export System, and it's found on our diversions website under reporting of regulated machines. And this shows you a display of what our website looks like. And we also have all the guidance and regulatory guidance for the regulated person and the community on when they report, who reports, what types of training guides are here, and all kinds of regulatory guidance is on our website listed here. So down in here in this part of the website, we have our training guides that walks you through how to create a user account so you can submit a 452 and how to complete an importation, DA form 452, exportation, or domestic transfer. And we have some contact information if you have questions or concerns. So a tabulating encapsulating machine, DA form 452, is a report. It's not a declaration or permit. It's a notification to DEA that the transaction has occurred. So it doesn't require any reporting on documentation. It requires a form to be filled out describing the particulars of the machine itself. And we review those 452s, and then once we file them, a transaction ID number is generated. That ID number is what is proof that the regulated person has filed with DEA, and they can use that for customs purposes. What's the purpose of the form is, like I said, is to notify of an importation, exportation, or domestic transfer transaction of a regulated machine. I mentioned the time restraints and identification number. So these are all very important pieces of information for the regulated person to file with us. And the type of information that's found on this form talks about the buyer and seller and broker points of contact, the date of the transaction, the purpose and need for the machine being imported, exported, or domestically transferred, and any information on the make and model, type of machine, and also if serial numbers are available to provide that. The form also requires information on what port of importation or exportation and the type of transportation is involved, and then who is filing it. The authorized individual is the one who holds the account. And if in an event that they're a registrant, then they also need to provide a DEA registration number. This is what the form looks like. I apologize, it's very hard to see, but essentially describes exactly what I talked about. The type of form it is filed, either an original or an amended form, in case there's changes to the notification form, the purpose and need, all the required documentation, the buyer, seller, the broker, consignee, consignor, and then all the details on the regulated machines themselves. There is record keeping requirements that the regulated person must maintain for the records for up to 2 years. There's also a requirement the seller provides gets proof identification, and so that we verify that the third party of the transaction is legitimate. So either it's a business, they can verify the legitimate business. If it's an individual, they're required to prove 2 forms of identification, either a driver's license, other form of identification. And if for transactions with new customers who are not individuals or past customers, the regulated person shall establish, identify authorization persons, agents or agents, the file including their signature, electronic password, and so forth. So in the event that the machine gets detained at customs, it's what happens is that the customs reaches out to DEA and verifies that a 452 has been filed. In the event that they either did not file or they are not compliant with the timely filing, then the machine gets detained at the border, contacts headquarters. We send out an information referral to the field to do a further investigation, see if the machine is for legitimate purposes. And if it's for legitimate purposes, then they would file a non-compliant 452 to bring the machine into the country. And then, of course, they need the regulated persons would need to coordinate with their local DEA office and customs to release the machines. The process for this would be a regulated person would submit a 422 through our online system. Our staff, Alyssa Lanahan is our import export specialist, and I'm either me or her would review the 452. And if it's compliant, then it gets accepted and then a file with a transaction ID. If it's non-compliant, then we notify the customs as non-compliant in the field for further investigation. Okay. So some of the challenges that we face, there are many challenges, but some of the challenges include many tabulating canceling machines are imported in multiple parts and pieces to make detection very difficult and monitoring by DEA and customs. We also have challenged that, like I mentioned earlier, regulated persons are not DEA registrants. Therefore, DEA has less enforcement capabilities to enact with the regulated persons. You can't go out and physically go to the address like you do for DEA registrants and do a full investigation and background on the individuals. And lastly, business entities who are engaged in legitimate industries such as candy manufacturers and pool tablet manufacturers or other industrial uses are unaware of DEA's reporting requirements. And when they find out, it's usually too little too late, and that their machine is detained at the border and or seized. So our contact information for further inquiries, you can reach us at our tabulating and encapsulating machine general email box. And that's all I have. Thank you so much.
Thank you very much, Paul. That was very informative. I think you fulfilled your brief of Import-Export Regulations 101. It was very informative and, you know, very, yeah, as I say, informative. And it really gives us an idea of how the US are trying to tackle the issue of, you know, tableting machines and encapsulating machines used for the manufacture of illicit drug substances. Yeah, I'm coming from the European region, and as far as I know, I haven't heard of any countries with regulations like this. but I'll be keen to hear from any of the other participants who are doing something similar as a way to try and prevent the abuse of such equipment. I want to hold the questions until the end. I hope that's okay for you.
Yes, absolutely.
Okay,
Thank
so let's move on. I think we're in good time. Let's move on to our next speaker. We'll jump to Brian Escamilla, and he's the Clan Lab Program Manager at Network Environmental Systems. And he's going to talk to us about the work that he does in the private sector, delivering public sector training. And I'm hoping the audio is okay for you, Brian.
Yes, I'm going to try and share my screen right now. Can you guys see that? Can you guys hear me?
We can hear you. We can see it. Go ahead, please.
Okay. Well, thank you guys for having me back. I appreciate every opportunity to get together with you guys and to talk about the private sector partnerships we have. Uh, this is going to expand the ways we can help the State Department engage in some of the regions across the world. And when we go looking at the clandestine operations, most of them is going to be pharmaceutical, but every now and then we do have some other areas that start to pop up with chemical, biological, explosives, and stuff like that. And with the private sector, we have the capabilities then to specialize the training and make it more finite towards those people in those areas. So with the pharmaceuticals, even with the pharmaceuticals, we've been engaging with some of the countries. The types of clandestine operations have been also varying from methamphetamine to fentanyl to some of the substituted cathinones. So when we look at the types of operations, again, we're trying to incorporate what the State Department's trying to engage with some of these countries and give a more specialized, customized training to these areas of the world that need the specialized training. So when we go into country, some of the things, and I'll get into the specialized training for these clandestine operations, but one of the things we've noticed is as we put together laws internationally or in that country for regulation of precursor chemicals or the drugs themselves, a lot of the clandestine operations will try and stay off the radar by synthesizing the precursors or synthesizing the reagents that are now being watched. And so there's always technical updates that need to be made to those regions to let them know that, hey, here's the new chemicals that are starting to come into the country, and here's why. To keep off the radar, we've obviously got chemicals we're tracking. So if they can purchase chemicals we're not tracking or not looking at, it's a means for them to continue on discreetly or clandestinely. So once we go through the country and we train them up to date with the current trends in those areas, the personal protective equipment they would need to protect themselves, we then start wandering into the chemistry behind why are they bringing in some of these other chemicals and what to look for. With that, we also would cover chemical diversion and investigations to try and see where these chemicals are coming from, to track down the larger criminal organized groups. And then as we address these new compounds or new routes or new drugs, we try and keep an update with what are the new hazards they're up against now. Are these transdermal threats, inhalation? Is there gases or vapors coming off the reaction that we need to address for those responding to the sites? And so as we address all that, we've also got an increase in the amount of technology that's being employed into this investigation area. So we've got Raman, FTIR, mass spec, GC mass spec. We employ that technology and where it's capable of helping and the limitations of it as it applies to the operations they're going to be conducting out in the field. So as far as the specialized training, we've tried to simplify it as much as possible. There's a core level of training we try to implement into these countries. And one of the things we could look at is your basic core training of hazmat, how to put on the suits, boots, gloves, the respirators, the type of chemical suits, the types of gloves that are out there, and then the principles of toxicology. What symptomology would the public have if there's been a release? What symptomology would a teammate have should they be exposed to some of these chemicals that are on site? So we talk about the toxicology, the pharmacology. We've got threshold values for certain chemicals and what are safe levels. So not only for their team, but for the public in that area, so they get a better idea of the toxicity of some of the materials they're working with and some of the hazards they're up against when they hit a site. So it's involving not only the PPE that these guys can be wearing, identifying specifically what type of route. And the one thing we emphasize that's very key for these teams going in is they've got to assess what is going on. They got to be right. If they think it's methamphetamine, they better be right that it's methamphetamine and not explosives, because some of the chemicals cross over, and we train them in that. But when they hit a site, they have to verify that they know what it is after investigating it, what it is that's being made there, because then they can determine the hazards. Beyond that initial training, we go to a site safety officer, and this is managing the scene. This is the person that's going to be able to make that statement, no, we got to pull the team out. Things have gotten too dangerous. Start making phone calls for explosive units or maybe some federal units that have WMD experience. But this is going to be the person that's going to be in charge of the site. So we do have a site safety officer for the more experienced and kind of progressively move the students through that area of training. Up until the point where we get to what are called level A operations. These are fully encapsulating moon suits. Typically, these are areas where we have the highest level of skin threat, transdermal, and we need the highest level of skin protection. This is the highest level of hazmat we can go, and we could train in areas where fentanyl, synthetic opioids are now coming into play, which are hitting certain parts of the world. We could spin those guys up in the level A. And so again, we kind of choreograph the threats in that country with where they need to be with their training and kind of specialize that training into, and if we need to, any type of chemical warfare, biological, radiation, explosives, and in that type of arena. The private sector has the capabilities to go out and retain the chemists and the people who've done field response to go in and safely assess and identify what type of operations are going on. And then we
And Brian, my
implement the new.
apologies. I'm very sorry for interrupting. The interpreters are asking you to slow down, please. Thank you so
Oh,
much.
no problem. And then we could incorporate the newer technologies that are available to us today, like the Raman, FTIR, mass spec, GC mass spec. We could integrate that equipment into helping them safely assess and identify what compounds they're dealing with on site. So a lot of what we do is going boots on the ground with the teams that are out there. We found that it's better to go hands-on with these guys, to actually put them in the suits, have them conduct operations under training scenarios with mock scenes and mock lab scenarios to enter the sites. With this, one of the things we addressed is obviously heat stress and cold stress for the personnel that are going in and out of these suits. So we have the abilities to send them in, have them demonstrate that they could competently enter a site with air monitoring equipment, identify the threats, identify what it is that's being manufactured, and then in the final process, what are they going to sample? There are certain chemicals, and we run through this of things, what to sample and what not to sample. There's certain things the laboratories can identify and certain things the laboratories don't want. And so we go through and kind of identify, based off evidence collection, what they need to gather and what needs to be disposed of as hazardous waste. We also cover the waste disposal process, how to pack it safely, the labeling requirements. We use Department of Transportation, there's UN numbers, the filling out of shipping papers to correctly track the waste. And then we also go through these scenarios and have these guys go through a decontamination. So we need to decontaminate the personnel coming out of the site. We need to decontaminate their equipment. And so we talk about the decontamination protocols based on the type of operations and chemicals that they're up against. So one of the things about going boots on the ground with these guys is we get to have these guys go hands-on in controlled scenarios, operating as they would out in the field and identifying some of these unknowns. We leave them the test kits, and they're simple test kits to identify what it is they're up against, the hazards those chemicals possess. And then we have a chance to evaluate the personnel, the teams as they're trying to work together and come up with decision-making processes as to what type of operation they're dealing with in country. And the other thing is it's very critical is for the respirators and the equipment that they're going to be wearing, we want to make sure it properly works and it properly fits. there's no use giving someone a respirator if it's going to leak. And so with the respirators, we do fit testing for them to make sure that the respirators that they are going to be wearing actually fit them. And then we make sure that they're fully aware of the limitations of both the cartridge and where they need to go to supplied air types of respiratory systems. Now, out there also are assisting software programs. One of the things we do is we implement the programs, the literature, the books, or the apps that are out there that would allow these individuals to help kind of assess their area. How big of a hot zone do they need to set up around this 55-gallon drum of methyl ethyl death? We could look that up. There's protocols and criteria that have already been established for maintaining certain work zones and buffered areas for dealing with some of these chemicals. Now, one of the things we've also done is we've put together, and the benefit we have with private industry, we specifically put together field guides that are laminated, that they could take out into the field, they could decontaminate them if necessary, but they go over the current chemicals that are trending in the pharmaceutical or some of the other areas for clandestine laboratories. So they can look these chemicals up when they're on site in the hot zone, looking at the chemicals. We've also put together their air monitoring results, how to interpret them, at what point they need to pull their team out, at what point things become too dangerous. So we've put together field guides that kind of help assist these personnel that have been trained in hazmat. They're cheat sheets for hazmat teams going in. So private sector allows for the generation of these types of products to help, once we've trained these people, to competently assess and do their jobs out in the field, especially working in these hot zones, and especially with some of the threats that we've got today with a lot of these highly toxic, highly potent opioids that we're up against. And then the last thing we do is we usually leave these guys our numbers should they run into trouble out in the field, having a hard time assessing what certain chemicals might be there for. We leave them our contact information, and we continue to get calls from around the world of teams hitting sites and being confused with maybe some of the chemicals and what their place would be in this type of laboratory, to find out that in certain laboratories they're making 2 compounds and not just 1. And so we often will assist them with technical support afterwards, once we've trained these teams, if they should run into questions or problems out in the field, that we can assist these individuals. So another challenge we've got is the language barriers. As we try to conduct this training thoroughly and competently, there is always a language barrier that exists in certain countries. And so one of the factors that we could do as private industry is make sure that all the materials, the PowerPoint slides, their manuals, the tests, the quizzes, even the field guides that we leave them with are translated into this foreign language. And so we have that capability then of, we translate all the materials over, and then we have a technical person go through to make sure that the translation is accurately being reflected, because often we'll find that the translation from English to another language isn't often exact. And so we'll do a mass translation, but then we'll have a technical expert go through and make sure that the chemical names are correct, that some of the terminology is accurately being translated. So on top of all that, we do set up the translators in class, and we do for the lectures themselves, we try and find a native speaker if possible to help conduct that class. But in the presence where we have English being spoken, we do have translators set up, and all the translation equipment we get rented and in place for the classes and for the trainings themselves. So with translating all not only the lecture material, but the manuals and the field guides, it helps for an easier transition of that information and the missions that we're doing with the State Department to operate in some of these other countries going forward. So that's it in a nutshell of some of the private sector capabilities that we can help the State Department with as they try and engage in some of these other countries. The clandestine laboratories is a slippery slope. It's constantly changing. We've left it open for doing updates for those that have been trained on the new technologies, the new chemicals, the new threats that each of the countries are up against. But once we get the core training implemented and the teams in place, the updates are easier to do. We could even do that as something simple as a webinar, just to update them on why new chemicals are arising in that country. And again, often it's so they can manufacture their own precursors, their own reagents. And until those compounds get identified and regulated, or at least on some type of a watch list, we give them an idea of what it is they're looking for, what to look for, and the new hazards that they're now up against in their areas.
Brian, thanks a lot. That was excellent. I think we get a good idea of the services that the private sector can give to public authorities, law enforcement, etc., who are having to deal with illicit laboratory investigation. Again, I think we'll hold the questions until the end, and I'm hoping that Mark has been able to join us now.
I'm
Mark,
hoping
are you
to.
with us?
Can you
Yeah.
hear me?
We hear you. We hear you.
All
That's
right.
good.
I'm already jealous of Brian's video and sound technology. It's much better than mine. So what I was asked to do, and I'm kind of excited to be part of this group, which I've not heard of before, is just to give an industry perspective on what we're doing to deal with trafficking and illicit trade. And so I actually wear two hats. One hat at Maersk is the global head of special operations, which is really dealing with all kinds of contraband. So not just illicit drugs, but wildlife, timber, guns, cars, everything that the international supply chain is used for. And then the other hat I wear is the World Shipping Council. I'm head of the Trafficking and Illicit Trade Working Group. And the World Shipping Council, if you don't know them, they account for 95% of maritime trade, its membership. So within those two things, I think as an industry, I can speak for Maersk and I can speak somewhat for the industry, we're pretty engaged. On the Maersk side, our global special operations is really, it's within global security. It's a group of professionals that deal regionally with international authorities. We work with UNODC, we work with World Customs Organization, we work with customs administrations, individual customs administrations, and we work with police and investigators around the world. A lot of our time is dealing with mostly narcotics, being cocaine, if that seems to be a major player. But we as Maersk have been involved in the precursor fight, working with other authorities, doing what we can to impact that. So the WSC also has taken this up. We had a presentation on precursors, and we also provide some insight and training on how cargo moves. So understanding our role in terms of international transportation, I think is an important aspect, a critical aspect of how this moves. And the best, I have to say, because I really wanted to boil this down, and we talk about partnership. And on a lot of this, it's truly trusted partnership. And trusted partnership is a small group of strategic thinkers. And so this is it's a dangerous business. All of it is a dangerous business, but also, we have to be able to share, the authorities have to be able to share intel with us. Not everything, not all of it. I don't want to know all of it. I don't need to know everything, but I need to know enough to help. And so I think the only way to do that is through these trusted partnerships that we've developed as Maersk, and we've developed within the World Shipping Council. So we've done it in two places, both as a trade association and both as individual carriers. And sharing that intel is so important because we are dealing with precursors that have some legitimate uses, right? And you heard in the DEA presentation. So you have legitimate shippers shipping to illegitimate consignees. You have front companies. You have all these different kinds of things. From our perspective, we might not know that these are bad actors or these are co-opted supply chains. So for us to help and to assist, and we certainly want to, we need to know enough to help and assist. And that comes from, we're dealing with intermediate shippers, we're dealing with freight forwarders who aren't necessarily identifying the parties that are of interest to you. So again, it's different than cocaine, it's different than guns. You see cocaine, it's cocaine, you see guns, you see guns. You see precursor chemicals, and you don't know again, from a carrier perspective, from international logistics, you know, all of this stuff moves by air, sea, truck, and land. And precursor to finished product, you know, it all moves somewhere, somehow. And I know for Maersk, we're an integrated logistics company, so we do it all. We do air, land, sea, and truck. And so it's important for us to know what you're looking for and who you're looking at, again, in that very trusted environment. And I go back to that because really that's the key to engaging with industry. I mean, we can have high level discussions and we can share processes, but if you're really looking to make an impact, it takes that trusted relationship to work with, again, with me, Maersk, with other carriers, with the World Shipping Council in a very small environment. That's really the key to this. That's really the key to engaging industry, at least the maritime logistics industry. To me, I would stress that is what has to be done. And I think we've demonstrated, again, as a group, we've demonstrated as a company that we can do that. And so I certainly offer that opportunity moving forward. And then just the last part is the timely action, right? So you hear about the customs process, you know, where you intercept at port of load, at transshipment port, at port of discharge. It goes with airports as well. It's all the same terminology. Where you take your action is important for us to understand that what we have to do to allow that cargo to be stopped with authority. So there's a lot of coordinated efforts. So it's strategic sharing and it's coordinated efforts that help legitimate trade and help also the interception of illegitimate trade. And that's really the approach that I wanted to share.
Thank you so much, Mark. And I'm really glad that the technology worked out in the end. It was very clear. So we got all your messages. And I'm very happy that you were able to join us, bringing this different perspective to our Global Coalition meeting today. You raised the issue of trust, and I'm wondering how you go about this in a practical level. Are you making building relationships based on formal agreements, or are you doing this in a more informal way?
Yeah, so good question.
Sorry, I'm kicking up. Oh. I'm opening the questions. I'm using my privileges as the chair to take the first question.
Excellent. So it is a good question, and I have to say.